Press your thumb into your ankle for exactly 5 seconds and let go, right now. Do it on the fleshy part just above the bone. Count it out. 1, 2, 3, 4, 5. Now, remove your thumb. Look closely at the skin. Did it bounce back instantly, or did it leave a dent? That dent is called pitting, and it is the single fastest way to tell if your swelling is just tissue, or if it is fluid retention caused by something deeper. In this video, we are going to grade your swelling. We are going to find out if you fail the symmetry rule. Check if your medication is actually the villain. And I am going to show you the one sleeping position that actually drains the fluid. Swelling after 60 is rarely just about getting older. It is a specific communication from your circulatory system. Your body is trying to tell you something about the efficiency of your heart, the state of your kidneys, or the side effects of your daily routine. We often ignore these signals because they usually happen in the evening. You wake up with thin ankles, you go about your day, and by dinner time, you look down and see that your socks have left a deep, angry ring around your leg. You might feel a heaviness, like you are dragging weights around your house. This is common, but it is not something you should simply accept as the price of admission for aging. It requires attention. If you value straightforward, evidence-based wisdom for the prime of your life, take a moment to subscribe to the channel. We are building a community here that believes wisdom is perfected with age, and that means knowing exactly how your body works so you can keep it running smoothly. Let us start with the mechanics of why this happens. To understand your ankles, you have to understand gravity. For 60 or 70 years, your heart has been fighting a battle against gravity. Every single minute of every single day, your heart is the pump, and your veins are the pipes. Arteries take oxygen-rich blood down to your toes effortlessly, because gravity helps them. But getting that blood back up to the heart and lungs is a much harder task. It is an uphill climb. Your veins have a secret weapon to handle this climb. Inside your leg veins there are tiny, one-way valves. Think of them like little trapdoors. When your heart beats and muscles contract, the blood pushes up, the trapdoor opens, the blood goes through, and then the door snaps shut to keep the blood from falling back down. It is a brilliant design. But like any mechanical part, these valves can wear out over decades of use. The seal gets a little loose, the hinges get a little stiff. When that happens, the trapdoor does not close all the way. A little bit of blood leaks back down and pools in the lowest possible place. That is your ankle. This condition is often called venous insufficiency. It is not necessarily a disease. It is often just wear and tear. However, we need to distinguish between this mechanical wear and tear and something more systemic. That is where the pitting test you just did comes into play. If you pressed your thumb into your ankle and the skin sprang back immediately with no indentation, that is typically non-pitting edema. That creates swelling, but it is often related to the lymphatic system or perhaps a thyroid issue. It feels different. The skin might feel tight or thick. But if you pressed your thumb and it left a pit that stayed there for a few seconds or even a minute, that is pitting edema. That pit tells us the swelling is mostly water. It is fluid that is leaked out of the blood vessels and into the surrounding tissue. Imagine a sponge soaked in water. If you press it, the shape holds. That is your tissue right now. This is the type of swelling we need to investigate because it is directly tied to the pressure inside your veins and the salt balance in your blood. This brings us to the most critical safety check you can do at home. It is called the symmetry rule. Look at both legs. Are they swollen about the same amount, or is one leg significantly larger than the other? This distinction changes everything. If one leg is fine and the other is twice its normal size, red or hot to the touch, that is a red flag. Unilateral swelling, or swelling on just one side, can sometimes indicate a blockage, like a deep vein thrombosis or a blood clot. A clot acts like a dam in the river. The blood cannot get past it, so it backs up and swells rapidly. If you see sudden, painful swelling in only one leg, that is not a wait-and-see situation. That is a call your doctor immediately situation. But if both ankles are swollen and they look roughly the same, the cause is likely systemic. That means it is affecting your whole body. The fluid is pooling in both legs because gravity affects both legs equally. Systemic swelling is usually what we see with heart, kidney, or liver issues, or medication side effects. Speaking of medication, this is the angle most people miss. You might be worried about your heart function, but the real culprit could be sitting in your medicine cabinet. Millions of seniors take medication for high blood pressure. It is one of the most common prescriptions after age 60. There is a specific class of drugs called calcium channel blockers. You might know them by names like amlodipine. These drugs work by relaxing your blood vessels so blood flows more easily, which lowers your pressure. That is great for your stroke risk, but there is a catch. When those vessels relax, they can become a little too permeable. Fluid leaks out into the tissue more easily. If you notice that your ankle swelling started a few weeks after you began a new blood pressure medication, do not stop taking the pill. That is dangerous. But do bring it up with your doctor. It is a known side effect. Sometimes, simply adjusting the dose or switching to a different class of medication can make the swelling vanish overnight. Another common offender is the pain reliever you might be taking for your knees or hips. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen or naproxen, are famous for causing the kidneys to hold onto salt and water. You take a pill to help you walk better because of arthritis, but the pill makes you retain fluid, which makes your legs heavy, which makes it harder to walk. It is a vicious cycle. If you are taking these over-the-counter painkillers daily and noticing swelling, you need to audit your intake. Now let us talk about the pump. The heart. This is the fear that keeps many people up at night. Is my swelling a sign of heart failure? It is a valid question. Congestive heart failure essentially means the pump is not strong enough to move the volume of fluid in your body efficiently. When the right side of the heart struggles, blood backs up in the veins, leading to swollen legs and a swollen abdomen. But you rarely get heart failure symptoms in isolation. Your ankles are just one part of the dashboard. You need to look for the other warning lights. The biggest differentiator between simple aging veins and heart issues is your breath. If you have venous insufficiency, just the worn-out valves we talked about earlier, you generally breathe fine. You can lie flat in bed without issues. If the swelling is related to your heart, it is often accompanied by shortness of breath, especially when you lie down flat. Do you need to prop yourself up with 2 or 3 pillows to sleep comfortably? Do you wake up in the middle of the night gasping for air? Do you get winded walking to the mailbox when you used to be able to walk around the block? If you have swollen ankles combined with breathlessness and fatigue, that is the specific combination that warrants a thorough checkup with your cardiologist. It is the pairing of symptoms that matters. Another major clue is sudden weight gain. Fluid is heavy. A gallon of water weighs over 8 pounds. If you step on the scale and notice you have gained 3 or 4 pounds in just 2 days, you haven't gained 3 pounds of fat. That is mathematically impossible to do in 48 hours. You have gained 3 pounds of water. Rapid weight gain is a primary indicator that your body is holding on to fluid aggressively. Let us shift gears to what you can actually do about this. You have done the pitting test, you have checked for symmetry, and you are monitoring your breathing. Now, how do we get the fluid out of your legs? The standard advice is to elevate your legs. But most people do this wrong. Sitting in your recliner with your feet on the footrest is comfortable, but it is not elevation. In a recliner, your feet are usually at the same level as your hips, or even slightly below your heart. Gravity is still neutral there. It is not helping you drain. To actually move fluid out of the tissue and back into the central circulation where your kidneys can filter it out, your feet need to be above the level of your heart. That is simple physics. Fluids flow downhill. You need to lie on the couch or bed and prop your legs up on a stack of pillows or a foam wedge so that your ankles are higher than your chest. You only need to do this for about 20 or 30 minutes in the evening. It allows gravity to work in reverse, draining that pooled blood back toward the core. If you do this while reading a book or watching the news, you will often find you need to use the restroom shortly after. That is a sign of success. That is your kidneys doing their job because you finally gave them the fluid back. There is another pump in your body that you might not know about. We call it the calf muscle pump. Your heart pushes blood down, but your calf muscles are responsible for shooting it back up. Every time you take a step, your calf muscle contracts. That contraction squeezes the deep veins in your leg, shooting the blood upward through those valves. It acts like a secondary heart located in your leg. The problem arises when we stop moving. As we get older, we tend to sit more. We sit to read. We sit to watch TV. We sit to visit with friends. When you sit, the calf pump is turned off. The blood sits stagnant. The pressure builds. The fluid leaks. The swelling begins. The most effective way to reduce ankle swelling is to engage that pump regularly. You do not need to run a marathon, you just need to walk. Even walking around the kitchen island for 5 minutes every hour keeps the pump primed. If you have limited mobility and cannot walk easily, you can still work the pump. While sitting in your chair, do ankle pumps. Point your toes all the way forward like a ballerina, then pull them all the way back toward your shin. Do this 20 times. You are manually firing that muscle and squeezing the veins. It is surprisingly effective. We also have to talk about salt. You have heard it 1,000 times, but after 60, your relationship with salt changes. Your kidneys become less efficient at filtering sodium as you age. It takes longer to clear a salty meal from your system. When sodium stays in your blood, water stays with it. Water loves salt. It follows it everywhere. The tricky part is that the salt is rarely coming from the salt shaker on your table. You could throw your salt shaker in the trash and still be consuming double your daily limit. The salt is hidden in the bread, the canned soup, the deli meat, the salad dressing, and the frozen meals. These are the sodium bombs. If you are dealing with swelling, try a 2-week experiment. Cut out processed meats like ham and bacon, stop eating canned soups, and avoid frozen dinners. See what happens to your ankles. Many people find that their evening swelling reduces by half just by changing their lunch choices. Now, let us address a tool that everyone hates but everyone needs: compression socks. I know, they are tight, they are hot, and they are impossible to put on. But they are the gold standard for a reason. They provide graduated pressure. That means they are tightest at the ankle and get looser as they go up the leg. This creates a pressure gradient that physically forces fluid to move up the leg. It supports those worn-out valves we talked about earlier. The objection I hear most often is, I can't get them on. If you have arthritis in your hands or difficulty bending over, compression socks feel like a wrestling match. But you do not have to struggle. There are devices called stocking donners, simple wire frames that hold the sock open for you so you can slide your foot in. There are also socks with zippers and socks made of newer, stretchier materials that are easier to handle. You do not need the intense surgical-grade compression unless your doctor prescribes it. Even a light compression sock from the pharmacy, usually rated at 15 to 20 millimeters of mercury, can make a massive difference in how your legs feel at the end of the day. Another practical tip involves your skin. When legs swell, the skin stretches. It becomes thin, dry, and fragile. It can itch intensely. This is called stasis dermatitis. If you scratch it, it can break easily and become infected. Because the circulation in that area is poor, it takes a long time to heal. Make it a ritual to moisturize your lower legs and feet every single night before bed. Use a thick, unscented cream. This keeps the skin elastic and prevents those microscopic cracks that can let bacteria in. It is a small act of self-care that prevents major complications down the road. Let us summarize the checklist you should have in your mind. If you have swelling, go through these steps. First, do the pitting test. Is it fluid? Second, check the symmetry. Is it both legs? Third, check your meds. Are you on a calcium channel blocker or NSAID? Fourth, audit your breathing. Are you short of breath? If you have swelling in both legs, it pits when you press it, you breathe fine, and you feel generally well. It is likely the common venous issue related to aging. You can manage this with the lifestyle tweaks we discussed: elevation above the heart, watching hidden salt, and using the calf pump. However, there are specific times when you must make the call to your doctor. Call if the swelling comes on suddenly. Call if it is only in one leg. Call if it is accompanied by chest pain, difficulty breathing, or coughing up pink, frothy mucus. Call if the skin over the swelling becomes red, hot, and shiny, which could indicate an infection called cellulitis. And call if you are gaining more than 3 pounds in a couple of days. You are the expert on your own body. You have lived in it for over 6 decades. You know what normal feels like. The goal of this knowledge is not to make you anxious about every little puffiness. It is to give you the confidence to know the difference between a nuisance and a warning sign. Swollen ankles are a message. Now you know how to translate the language. Take control of your evenings again. Try the elevation technique tonight. Watch your salt tomorrow. See if the heaviness lifts. If you found this explanation helpful, please hit the like button so this video can reach more people who are trying to navigate their health with wisdom. And do not forget to subscribe to Primetime Wisdom. We are here to make sure your best years are also your wisest years. Until next time, keep moving and stay attentive to what your body is telling you.